Hello, this is Mark and Caitlin here with On Your Mark Sports, and we're going to talk today briefly about the benefits of self-administered myofascial and trigger point release. These techniques have grown in popularity over the past decade amongst people all over the fitness spectrum, whether it's professional athletes or your everyday exercise enthusiasts, and with good reason. There are many benefits. One, it can help reduce trigger points in muscles. Two, it can help increase flexibility of those muscles. Three, it can help reduce muscle and joint pain. Four, it can help reduce the risk of injuries. And five, it can help increase and enhance athletic performance. Poor posture, intense exercise, repetitive use, and trauma to muscles can lead to what's known as the pain spasm pain cycle, where basically an inflammatory response causes muscle spasms and adhesions and the formation of trigger points in muscle tissue. When this happens, it can lead to improper biomechanics, meaning that muscles and joints can't contract, lengthen, and stretch properly. And when this happens, it increases the risk of injury. So why are self-administered trigger point release techniques effective? Well, just like with massage therapy, these practices can help increase blood flow and circulation to the muscles, bringing nutrients, oxygen, and helping to detoxify. Second, there's a mechanical process in which the fibers that are maybe adhered together, aren't sliding properly, are actually getting broken up. And the third is the nervous system response. Locally, there are particular neuroreceptors in the muscles that respond to external pressure. So with external pressure, whether it's self-administered myofascial release, trigger point, or it's massage therapy, the local receptors in the muscles are stimulated to help the muscles relax. But also on a systemic level, this process helps stimulate the parasympathetic nervous system, which helps reduce blood pressure and enhances relaxation, which has an overall systemic relaxing effect on the body, which helps the muscles in turn further relax. So because of this nervous system component, it's really important to stay as relaxed as possible when self-administering any kind of myofascial release. So some basic guidelines for self-administered trigger point release. First, breathe. Make sure you stay relaxed. Second, hold each spot anywhere from 30 to 90 seconds, depending on the intensity you're using. And third, make sure you don't friction, so rubbing back and forth on the spots, because that'll actually stimulate the nervous system to increase muscle tone. So you want to stay as relaxed as possible, don't friction back and forth, and hold for 30 to 90 seconds, depending on your intensity level. There are a lot of different props you can use for self-massage. It really depends on the part of the body that you're focusing on and how deep you want to go. So Caitlin, what are your experiences with performing self-myofascial release?
Yeah, as a dancer and as a very active person for most of my life, I didn't use trigger point release for a long time. But since I've started using it, it's really increased my flexibility and mobility and helped me work through some injuries. So it's been extremely beneficial and definitely helped prolong my career as a performer.
So be sure to check out all of our great instructional videos on our website on how to properly and safely perform self-administered trigger point release.